All right, good morning. It is March 21st. So this is actually the end of the full day of first day of spring. And it really looks like spring inside. Right.
Well, tomorrow.
No, not quite. But so this is Senate Health and Welfare, and we have just a couple things to do this morning. We've all been working extremely hard on crossover and getting bills over to the House. So we deserve a little time to get that work organized. So this morning, I thought we would do two things. One is to look at, get an update from Vice Chair Gulick on appointments, and then we'll look at the bills that we have from the House on the wall and talk a little bit about the ones that we will be getting in addition, and how we'll deal with some of that. Well, that's it. So Senator Gulick, it's all yours.
Fantastic. We have one person who's up for reappointment to the Board of Medical Practice, and that is Dr. Peter Ireland. And I did want to inform folks that yes, he would like to continue his work on the board. We had a great conversation. He loves the board. He thinks they're doing really good work. And he brings a unique perspective as a primary care provider, and he's the youngest person on the board. And he is also serving on the board of nursing. He's been asked to do that, so he's there as well. So just wanted to share that update with you. Like I said, I had a great conversation with him. He lives in Waitsfield. He has a 9-year-old child. He's not going anywhere. He loves Vermont. So
we need primary care.
Yes, we do. And I thanked him for his service and his work.
So are you recommending that we send his name to the Senate for approval?
I am indeed recommending that we send Dr. Peter Ireland's name to the full Senate for recommendation.
Okay.
Board of Medical Practice.
Is there any discussion on that? Questions for us?
Any skeletons in his closet?
Not that I could find. Absolutely not. It's a hardworking primary care doc.
Yeah.
Yeah. Senator Cummings might know him. Do you know Dr. Peter Ireland? He's in Waitsfield. No.
Board of Medical Practice. Young. Enthusiastic, also on the board of nursing. Okay. Really, really enthusiastic. It's great.
No, he lives in Waitsfield. Okay, that's the clinic in Waitsfield, so we probably being close.
Yeah, he lives there now.
That's medical primary care. CVMC is close.
So are you all great to?
Do you want to do a vote? What do you want to do?
I think thumbs up. Just a
Seems fun.
yeah.
He's already.
Wonderful. Wonderful.
We're good.
Thank you so much.
And you'll report it? You should take his
To
form up to the secretary.
Yeah, he's not gonna get individually
oh, that's right.
called up.
No, but you still have to have someone responsible for it.
Yeah.
So then, Senator, why not set up with Kiki as organized when Jenny Samuelson might come in? Is she the one we have?
Yeah, Jenny Samuelson and Owen Foster.
Oh, okay.
Yeah.
My suggestion is, given where everything is right now, to give them both a breath of fresh air for a while.
I agree. So Jenny Samuelson's term would be March 1st of 2025 to February 28th of 2027. Owen Foster's is in until was October 1st, 2024 to September 30th, 2030.
Okay.
So
I think maybe after,
couple in a few weeks.
yeah.
Okay, got it.
And we'll leave that to you, and then when you're ready to, when they're ready, I think, maybe you can get Kiki to get a little bio from each of them.
Sounds good. Thank you.
Good. All right. That's great. Thank you. Good work.
Thank you.
With alacrity.
What's alacrity?
Yeah. So
Get it done, right?
yeah. So our goal is, or our plan is to just have updates on appointments. Should we get more than our vice chair will be around us with.
Yeah.
And sometimes there won't be an update, we'll just say, that's it. All right, so, let's just spend a few minutes on the bills that we have and looking at the H bills. And I will also let you know that we're going to be getting the GA, General Assistance Housing Bill. I believe it's 891, but I'm not sure.
Yeah, I know. Dealing with that.
It's on the floor today. Okay, so is it H? Oh, no, look it up.
It is.
It is, okay, thanks. All right. Good. So you have a list in front of you of currently what's in the committee, and then knowing that there will be other bills coming over from the House, and we just want to, let's just take a quick look through, begins on the back page. So the CON bill, which is comparable with the bill or similar to the bill that Senator Dulick introduced, the answers together. And
96.
you did it? Huh?
That's 96, or sorry, H 96.
Age 96. Oh, I'm just looking through the list and so if there's, and then if you have a priority as you look at the list and you're familiar with them, just shout out about it. We have the PFAS bill, H 238. We have H 266, the prescription drug bill, 340B. And we will be getting two more bills that I know about. One is the GA housing bill, should be coming here. And the other one is a bill on regulation of hospitals from by the Green Mountain Care Board. So there's a bill that the House Healthcare has acted on recently, and I think it's still on the floor. What is it, 482? Thanks. H 482, which should also come here. It's relevant to the work that we did in our committee bill.
Will we be able to take any of these other Senate bills up?
So here's what I'm going to say about the Senate bills. Hold on a second. Let's finish what we're talking about here. Okay.
Yeah.
Got it.
No, Chair.
So the H 487, 482 is
Can I mention two other?
short. Help me.
By the way, Mike Fisher, healthcare advocate.
Perfect.
You also have, you said the 340B bill, there's H 259, related to preventing workplace violence in hospitals.
We'll be getting that.
You will. And you
What's
also
the number of that? 259, you said?
259.
Yeah, I worked on that one.
And did you say 237 act relating to prescribing by doctoral level psychologists?
Oh, that one we will get, yeah.
And
What number was that?
237.
237 and then H80. An act relating to the healthcare advocates.
Who's that?
Never heard of it.
I'm glad you asked that. All right, thank you. That's helpful. I mean, that gives you a better look at some of the coming to us. I did know about this. So 259 was
It may be, 259, workplace violence.
so that's the violence.
I think it did third reading yesterday.
Yeah. And what's 239? That's
237?
237 is prescribing.
oh, the doctoral levels prescriptions. Yeah, that was from we've looked at that one before.
Yeah.
And then something about a healthcare advocate.
80.
Okay. Thank you for that. We should get those bills, you never know, sometimes if deviation in the path, we'll make sure we do have them here. We also asked for a couple of Senate bills, and we'll talk about the Senate bills first. So let's go through the list, including those that we have not yet received. The one that's going to, that the House has worked on in, House Human Services for a long time, not just this year, but past years, is the GA housing. And we are going to want to spend some time on that one. And then the violence in hospital bill, this is a follow-up to work that we've done in the past on this. And then the PhD prescription drug, prescription bill is one we've looked at previously. We probably want to take that seriously. And then the healthcare advocate, I think, very important to us. The other bill on hospital regulation, the Green Mountain Care Board will look at and make a determination how to proceed with that one. We'll have to understand everything that's in it, the implications. And then the monetary thresholds for certificate of need. This is a bill that was requested by the Green Mountain Care Board, so we may have less pushback than some of the, we might not need to spend as much time in looking at alternative testimonies, but we will try to get everyone in on each of the bills that we look at. So look, as these bills come to us, well, we can't make a decision about bills we don't have, but I will say the GA housing bill is critically important for everything that's happening right now related to the motel hotel program in the Budget Adjustment Act, and all the work that's been going on for the past 5 years on the GA housing is has been time consuming and complex. So we want to be able to resolve some of the issues. I will say it'll be the end of it, but at least we'll get to a place where we have a program that is more doable than what we have now. Every year we have to go through a guesstimate of how many people will need housing, how much we're able to spend, and where we can put them, and what services are needed. So all of those things require time and effort on the part of both the administration and the legislature, and not to mention all the people out in our communities. I did take a look at the proposal a little bit, and it would probably be helpful as the bill is, the bill I think was voted out yesterday. The committee, and so it'll be up on the floor Tuesday. And we'll get a house in the house here, so we'll get a look at it. We won't get it until late next week at the earliest. Similarly, the violence bill is one that we worked on jointly with Senate Judiciary. I worked with Dick Sears on that bill. That was a really important bill to our nurses and our hospital and emergency room folks in particular. And so I don't know if that bill might go a dual route. It might be both here and in judiciary. I'm not as familiar with everything that's in the bill, but we do want to look at that bill. We do want to look at all. And then the CON bill, I'm thinking, as I said before, is less controversial. Definitely pick that up. So we'll have a chance to look at each of these. I don't know what bumps in the road we'll find. I really don't. Might be some problems along the way. I know there's going to be some juggling with the GA bill through the budget process. We'll work on that. The other thing I want you to add to your list, which we started yesterday, is budget. So we have budget recommendations. We don't go through the budget in the same way that the House Healthcare and House Human Services committees go through the budget. We don't have a full day of meeting. But we do listen to folks about what their requests are and what's in the governor's budget and what is being recommended from the House. So we will first, as the budget is completed in the House, we'll have joint fiscal come in and explain to us what is in that budget that relates to our jurisdiction. So we will do that. And then we can, then we'll bring folks in, with one day, or maybe 1.5 days at the most, to tell us why they are asking for the funds that are in the budget. And some of them will be the same as the governor, and some will be different. So we have to decide in here after we listen and after everything that we know based on our work, what we think we can recommend. What are our top priorities and how should we proceed? So to add to your list, the budget. And I will set up, Kiki and I will set up some time to hear both from joint fiscal and then from folks and advocates and organizations. Yes, ma'am.
Thank you, Chair. Madam Chair, I agree. I mean, I obviously support everything you just said. I want to make sure we're staying focused on reform too. So I'm wondering in terms of like reference-based pricing, we have it in our committee bill. We also need, another like vehicle to get that moving, like S55 or something similar. Or I don't know, that's what I'm asking.
No, we don't. Yeah, no, that would be like redundancy,
Okay.
Department of Redundancy.
Okay.
No, yeah. No, there's a lot of there. So, listen, if you go through some of the S bills that we have here, they resonate with the work that we've done. And there are people who have identified that piece of the healthcare system that appears important. And so there's a lot of what other folks have been wanting to do that are integrated into our bill. Obviously, we haven't done everything, so we'll be back. No question.
And in terms of continuing work that's already begun, I'd like to make a plug for the psychedelic therapy advisory group.
So let's hold on. You're still on S bill, so we're not to S bills yet.
Oh,
We'll ask you that question.
Not on S bills.
No, we're not
Gotcha.
there yet. We're just finishing up. We're going to do the budget. We'll have JFO in. We'll have organizations and advocates and Senator Cumming.
I'll be at this point because I'm sleep deprived.
You're not alone.
Feeling somewhat like fiddling while Rome is burning. I think we should have some time for contingency planning because we're worried about housing people. From what I hear, they may be starving while they're being housed. That there's major things coming in the SNAP program. There's cuts being proposed out there all over Medicaid. I forget what went through here the other day, but the word equity was attached, which is
Ahead.
no, it was another one.
Oh,
And maybe it was in taxes, but that's a red flag right now.
so that's another one we want to add to our list.
Yeah, I mean, we need
What
we
we
need
want.
to be keeping tabs on what's going on and have some idea of what we will do if and when it happens.
Mm. So I happen to know that the healthcare advocate has been working very hard on keeping tabs on some of the federal effects. It isn't something that we can bring in testimony each day and get the update, but having the collective knowledge that Mike Fisher has been pulling together on this, and then the Joint Fiscal Office is also doing that,
So
and the Treasurer's Office is doing that.
so we should get a report as to
Well, that's on my list.
what's the risk.
That's next on my list, so
Okay.
we will do that. The problem with doing it is it changes. and it's changing. It's volatile. So I have a list of Medicaid or a table of Medicaid changes that now needs to be updated. And I just got it from the agency, whenever last week. And so, but you're absolutely right. What can we do to stem the tide? The SNAP program is probably the one that people feel the most right now.
Yeah. Well, yeah, we need to stem the tide for sure, and strengthening our own healthcare system will certainly buoy us when times are
Absolutely. Yeah, good point. Yeah, good
so it's
point.
like kind of like two tracks, at least maybe three.
Well, we need to keep going on. We need to keep doing what we can do. And as we learned yesterday from Diva, there are effects that might definitely, and we know there are a couple bills in the House in Washington. We know that there might be a work requirement, all those things. How do we deal with them? And some of them are pretty complex. So we might also, think about this. We are here until May. Okay,
Through May or until May?
we're here through May, June, whatever.
Okay.
We leave. There's a big gap.
Yeah.
And so we need to ensure that our joint fiscal committee and other oversight committees have some insight into what's happening. So we want to think about sort of session law that gives some authority or work responsibility, oversight responsibility for everything that's happening. Think
I
of that.
think there's a bill in the works on that.
Huh?
There's a bill
That's like,
that's being put together.
right.
Give joint fiscal a little more authority.
We're going to have to do something like that, because otherwise we see the writing on the wall. It's sad. It's really sad. Did you want to say something?
Yes.
Yeah, please, go ahead.
I think so. Yes, I've been pulling together a group that's been coordinating a group that's coming together
Yeah,
weekly
you are.
on healthcare, not human services so much.
Yeah,
So to the extent that there's concern about
Yeah.
staff and the like, we are not tracking those things. But generally the answer at this moment is there's a ton of risk and we just don't know. And so it's sort of premature to come talk about the risk because it's everything under the sun. I mean, there is a new rule about exchange plans that is out and getting comments. And so we do know where the Trump administration is going there. That's something you could get a grasp.
so this is helpful. It will, we, maybe we should just talk about what you're thinking and we could get something on the agenda. I'm thinking that the agency will be important in coming in.
Absolutely.
I've already talked to them a little bit, but sort of designing who's coming in to inform us and with what frequency about what they're learning. So, yeah, but we could do this every day. You understand, right?
And then just lastly, I very much appreciate the conversation of setting up a decision-making process. We're gonna have to be nimble during this time and
Yeah.
outside of the legislative session.
Yeah, so, yeah, we have been talking about that, outside of here because it's broader than here.
Yeah.
So, okay, so we have a lot on our plate with those things. I mean, when you consider the influence of the federal effects on decisions that we make regarding the budget. It's not our job to do the budget, but we should be able to inform that budgetary process, the appropriations process. Not an easy thing. So Senator Douglas.
Morning. Which once you're done your thought, I would like to return to the discussion about escrow specific.
We'll go back to S. We're gonna go back to S. I know.
Yeah.
So, all right, so you see what is before us. These are our priorities. Okay, we gotta understand that. These are the critical priorities. The other thing that we all know, or at least those of us who have been here before understand, morning committees shut down a couple of weeks before, sometimes 3 weeks before the end of the session. So we end our work early and then so the afternoon committees have an opportunity to complete what they're doing. The finance and appropriations in particular. So just so you know that. So we don't have the luxury of time that we would like to have. It's always true. Senator Hart.
Just to inform you that come June, I have sent a formal letter to the president of the United States. And I will be going down to Washington DC to discuss Medicare and Medicaid for the state of Vermont with him.
Wow.
So just so I let you know, he accepted that invitation.
Are you,
And then I'll come back and report to you.
okay. We can talk about that. My question of you is, well, let's talk about that. That's amazing.
Yeah.
Good.
So he accepted my invitation.
All right, good. Good. Okay, but.
Yep.
Um,
You can give me a cheat sheet.
well, this is what we need to chat about. All right, so now I know that people are very excited about certain S bills that haven't left here. And I'm just going to give you my $2 speech. No. Oh, you see what's before us. Some of the S bills, I know you're interested, especially S64, which is the optometry bill. I know that there at least 3 or 4 of you have signed up. I know there's great interest outside of the committee. I know GovOps has passed it. I know that this is an ongoing issue. So there's no ignorance here about that. And I also know that when the bill is taken up, it is going to require some work. It's going to require everyone sitting at the end of the table and we have to listen. That will happen. I'm telling you that will happen. I have said to Senator Collmore and others, it might not happen. I'm thinking it probably will not happen until January, but we'll do it. So that there you have it. And if you have people, we need to have balanced testimony. And if you have folks who you feel are like Dr. Dean, he is very versed in this area, and there are others who will bring in to help us with it. So then there are other S bills. So that one is the one you wanted to hear about the most, is it not, Senator?
It is definitely, yes, in the top 3.
Okay.
Thank you.
All right. So if there are other S bills there that you think are important, like for example, I asked for us to look at S21 and also the other one, S26. That are important for prevention kids. S21 is the bell-to-bell cell phone. So they have in schools, phone-free schools. We may not get to that one until January, but you know what? And we haven't taken preliminary testimony on that. We took preliminary testimony on S64. And so if we can, we'll try to get preliminary testimony just so we understand what the bill contains. We'll go through those.
Okay, right.
And then are there others on this that you feel are critically important? And which one that, because there's a study in here that you could.
I wonder why every time. No, it's been a problem for a very long time.
Which one is it?
It's S99. It has been a problem for a very long time. The benefits split.
You did.
JFO has told me that they don't have any studies on it and that it is too complicated of a request to do research. I asked them, and they said, yeah, I'll get back to you with a report on that. But then 2 months later, they came back and said, this is a much bigger thing than we thought it was. Way too big of a request. It's very complicated. It's interesting, but we want a study. So JFO is asking for a study. And I think, honestly, 30 minutes of testimony, get AHS in here, get Nolan in here. And at the very least, even if we don't pass out, here's a bill, at least we've taken testimony on it, and we can add it as an amendment on something else.
Let's do that. That was the second thing you said. This one is something that we might be able to either get onto our bill or make a recommend down the hall. So, we can talk about that.
We've done a lot of work on the childcare benefit
Yes,
for many years.
yes.
The issue was, well, we may have solved it with the new childcare bill and the subsidies, but that
We
was the
did
big
smooth it a bit.
that was the big one, that you got a raise of, you got $500 raise and you lost $30,000 worth of childcare benefits. Yeah. But yeah, it would be especially interesting to see what the childcare bill, the impact was in that clip. Because that was the one that kept people from accepting promotions or all kinds of things.
Well, that would be something that we could ask in the report, including a review of how the child care bill has affected the children's benefits cliff that we did fix. So there are things we could do that one, but again, the more we talk about this, the bigger the issue gets, the less attractive it is for me to keep between now and June. You don't have time.
Just to mention, especially Senator Cummings, so my bill, S99, it's a study of all the benefits programs and where the funding comes from and kind of recommendations, how to tweak it, because Nolan wasn't really able to give recommendations or anything because the funding comes from different places and we can't touch those issues,
That sounds like something that they're probably asking for consultants. Because it is big.
Oh, there's another bill we might see, the opioid abatement fund. Appropriations, yeah, so I don't know whether they're putting that into the budget, so we may not see a bill. But we'll be looking at it.
Okay. And then I'll circle back to,
S-106,
yeah, it's just to echo what Senator Douglas said, it's work that's already started. I don't think it would take a lot of testimony time. It's an eager group of folks who want to continue the work. We have a mental health crisis. We know that this can be a help and aid and assistance to folks who are suffering. And there was some folks in the Department of Health who are interested in looking at the end of life piece of medical funds.
right, that's
I'm
important.
not finding this one. Yeah.
So, well, let's think about that, and there might be, I'm putting that on my list of bills that when Jen and Katie come in, we might want to look at briefly. We don't do the full flag, but we can look at those. Because again, this is something that can be added in to another bill or sent down the hall, as long as we vetted it here. Yeah, okay.
Great, thank you.
No, it's fine. And then I see a lot that would be simple to do, huh? They're never simple, but it would be less complex. I don't know that we'll have time to do any of them. The death certificate one is probably important.
I know. I was gonna bring that up too.
Restaurant meals is something that I think the House was considering. I'm going through the list. The Medicaid payment rates that's being considered in the budget. That's H13, we did that, but they're also considering rates for community DAs and SSAs in the budget. Yeah, the eligibility for pregnant individuals is one that this is hard because all of these things are going to require some waiver request. A lot of them. Yeah, if you recall, the federal government, it doesn't bode well Okay, so go through the list again. I think we've touched on the ones that you all are concerned about, and we've already passed some good bills out. Okay. There any others here? Oh, S74, which is the data privacy bill for healthcare. I haven't looked at what, or we're gonna hear what S71 is all about, and I think there's healthcare in there. So I'm gonna talk with VMS and Boz a little bit about what is in that bill as it compares with this. Senator Douglas.
I happen to be on institutions and we
Okay.
just pass out S71, so I can tell you a little bit. It does include some of the healthcare. It has HIPAA stuff in it.
Yeah,
Jessica Barn came and spoke about it. I think Buzz,
We did not have, Devin Green Buzz, we did not testify, but we signed on to the testimony.
yeah.
Okay.
So we gutted S71. We replaced it with the language from S93, which is Tom Chitten's bill for data privacy. And
that's Connecticut.
that's the Connecticut law.
Yeah,
It was a unanimous decision by the committee as, you know, it was gonna be the least controversial. It was gonna be a step in the right direction for data privacy advocates. And would be less likely to be vetoed. So,
good, okay.
but it does have.
Yeah, so we'll just make sure that there isn't anything missing from that bill that might be helpful to us in here. But, and we don't need to do that right away, but I just wanted to put that on the radar. We've already done 76 really with administration, death certificate, the important. Okay, I think we're doing pretty good in here, actually. We've done a lot of work. And some of the bills that we have on our wall, as I said before, they're being covered by House bills or they're being covered by our broader healthcare reform bill. Yeah, good work.
I think we might also get,
Are you laughing at your text?
No. Oh, it's Friday. I'm sleep deprived too.
we might also get, H321. I don't know if that'll come here.
What is that?
It's cannabis regulation stuff. I don't know where that.
So, yeah,
more economic, but
No, well, cannabis is one of those things that has potentially has a home in judiciary, health and welfare, economic development, appropriations, and sometimes finance. So it has a lot of little places to live. We will always provide input and speak up when it's about the medical aspects. So, yeah, I'll not forget the bill. Senator Hart.
Kyle Harris came in and did an interview yesterday with the government office,
Oh, good.
and he's the commissioner for the cannabis.
Who came in then?
Kyle Harris,
Oh, I don't.
he's in charge of the cannabis.
Right,
regulatory
right, he's,
And we passed him 5-0.
okay,
Very elegant speaker, very smart attorney. He's an attorney
yeah.
and he's in control of all the cannabis stores. So, yeah, we passed him 5-0.
All right.
Are you all right? No. I'll be back.
I don't know. So I think we've done enough for today.